The list of symptoms of COVID-19 is lengthy, and now a new study has determined there are 6 distinct types of the disease that involve different clusters of symptoms. And this new information could help doctors provide more acute care for patients.
When a person is diagnosed with COVID-19, doctors look for key symptoms: cough, fever, and loss of smell. Now, researchers at King's College in London have discovered 6 different types of COVID-19, each distinguished by a particular cluster of symptoms. The first group of symptoms include headache, loss of smell, muscle pains, cough, sore throat, and chest pain. These patients have an extremely small chance of needing emergency breathing support. The second cluster has the same symptoms as the first, but these patients also have a fever and experience loss of appetite. The third type includes gastrointestinal issues like diarrhea, but again, no fever. The last 3 types are more severe cases of COVID-19 and were more often seen in older patients with pre-existing conditions. Symptoms of severe level 1 include all of the usual symptoms and also fatigue. Severe level 2 is mainly distinguished by confusion. Patients forget where they are and don't recognize relatives. Almost 10% of these patients need oxygen or are placed on a ventilator. People at severe level 3 have both stomach pain and mental confusion. Nearly 20% of these patients need breathing support. Why is this important? This discovery could help doctors better treat individual patients and determine the level of hospital care they would need, in the long run, preventing more deaths.